Well, as the rolling blackouts continue across South Africa, the calls are rising for hospitals to be exempt. Let's speak now to Dr. Aslam Dasoo, convener of the Progressive Health Forum. Doctor, thank you for being with us. We've discussed this before, the situation in hospitals. I think at that point we were experiencing level 4 rolling blackouts. Just tell us the impact of level 6 of late.
Good afternoon and joyous Heritage Day to everyone who's watching.
You too.
Yes, so I think the situation has been significantly exacerbated because of the higher levels of load shedding. Hospitals, many of them do have generators which can keep them going for a short while, or at least parts of the hospital. But these generators were not made for managing a load shedding continuous schedule. And, they often run out of diesel, and there's no budget in the hospital to purchase diesel, and that's a management issue. But when the lower levels of load shedding were occurring, many hospitals around the country arranged with their municipalities to be exempt from load shedding. And I know it happens in the Western Cape, it happens in the Free State, and even here in North Gauteng, at Steve Biko. But for some strange reason, Southern Gauteng, which actually has the largest number of these very large hospitals, secondary hospitals and clinics, for some reason is unable or has been, unable to get us off this load shedding schedule. Now, what happens at the higher levels is that, of course, the generators or the UPSs that are in place run out, and then the cascade begins. You can imagine a beleaguered system that has been going through the throes of COVID, low staff numbers, often huge stockouts, lots of difficulties, management. We've spoken about these things many times. On top of that, now you have no power. And power and water are indispensable to a hospital because it runs 24/7, 7 days a week. And there's no chance that removing energy supply to a hospital will still allow that hospital to do what it must. There is definitely a deterioration, and that is measured in the numbers of people who die, actually, as a result.
Well, somebody prominent on Twitter the other day spoke about his best friend in ICU and without giving too much information, then said load shedding kicked in and he didn't make it. His friend, how often is load shedding fatal?
Oh, I think frequently enough. We have many hospitals in the country, and you will find, occasions where the loss of power for patients on ventilation in ICUs means that they have to be manually ventilated. You could do that perhaps for an hour or two, but you can't continue that manually. There just isn't the capacity to do that. And then patients tend to die. Incubators for babies, they break down, or, they can't work. Then, of course, there's the important support systems at a hospital, sterilization of equipment. They use huge amounts of energy. CAT scanners in trauma units, they use huge amounts of energy that generators can't manage. So what happens is that on an already poor situation, we now have a sense of growing crisis. And there must be some rationale to explain why the government has not managed to put most of the health facilities in the country off the load shedding schedule. It's certainly not a drain in any significant way on Eskom. And we know Eskom is a multifaceted problem. It's going to take years to fix. But we've been doing this for 14 years already. And we have on occasion gone very high to level 6, a couple of occasions before, and we immediately felt the impact. And that's the thing. Maybe you can lose power at home for several hours, as we do, or in businesses and so on. In a health facility, the impact is immediate and it's disastrous.
Yeah.
And so you have to just step up. I would think.
So you're saying you don't know why? I mean, so the areas that you've spoken about, so you're saying we need a national strategy, but then we know that the municipalities sometimes deal with the load shedding schedules. That's why Cape Town can play, and it's not always Eskom directly. Do you know what the complications are where you're talking about? You mentioned Steve Biko Hospital, for example.
So Steve Biko Academic is off the load shedding schedule. It's exempt. And so they don't experience load shedding. And that's just a short distance away. Charlotte Maxeke here in Johannesburg, or Helen Joseph, or Rahima Musa, or Tasani Bara don't enjoy that privilege of being exempt. And
so that would be Johannesburg, the Johannesburg load shedding, or are they directly supplied by Eskom? Do you know?
No, it's City Power. So obviously you would make a deal with City Power. There's a metro, there's a council. This is an urgent matter that requires intervention right now. And cities have the capacity to do that. If they could do it in Cape Town or in Bloemfontein or in Pretoria, why not in Johannesburg? It doesn't make sense. Look, I'll say this, that there's probably a great deal of lack of capacity in the management of the Gauteng health system here, both at a local level and at a head office level. And I mean, we've seen it when Rahima Musa and Helen Joseph ran out of water, it was a year or so ago, because of load shedding. The reservoirs or the pumping stations didn't work. The department stood there wringing its hands, not knowing what to do, for 3 weeks, until a charity, the Gift of the Givers, came in, drilled 2 boreholes, and voila, there was water. Not only for the hospital, but for surrounding communities. So I cannot understand why there has not been this proactive approach by the department to at least protect the facilities from load shedding, even if there is, we know, the chronic problems of mismanagement and corruption and all the other difficulties we have. You can remove this difficulty immediately from the equation.
Doctor, sorry, we're running out of time. I'll see if we can actually speak to City Power. Have you tried to? My final question.
No, we haven't spoken to City Power, but we've engaged with the Gauteng government on a range of issues. And we know that there's a huge public outcry about this. There's a petition of thousands of people saying, do this. And I think that's the most important. My suggestion is that you speak to the Gauteng Department of Health. City Power is not going to do it on its own. There will need to be a approach.
So we would need local and provincial working in tandem. Again, Doctor, we've run out of time, but thank you for this, and we'll see what we can follow up there. So some of the hospitals are currently exempt, but some are not, and that is the issue here. And the doctor confirming that for some means life versus death. Dr. Aslam Dasoo, convener of the Progressive Health Forum.